Okay, welcome. We will go ahead and call the July 28th Grant County Health Board meeting to order. I would like to have a review of the minutes from the May 19th meeting, and we'll entertain a motion for approval.
A motion. I'll second it.
All in favor?
Aye.
All opposed? Motion carries. Minutes approved. Division reports are provided for us. Do we have anyone that's speaking on behalf of any of the division reports tonight? Okay. Questions? Okay. We can review the environmental division report first, if anyone has questions or concerns.
Says animal bites on this one, 31, and over on the other one it says 25. And I think it's the same dates. But
I'm sorry, what was that?
animal bites, 31 on one page. And then over on the diseases and the nursing one, it says 25.
So environmental, it brings them in and processes them through different than the nursing office does. So I'm sure it's just, when they run their report,
Okay.
it comes through different when they run their report.
Okay.
This report you're looking at on the nursing division is something that's generated weekly. And so it's, this might have been even, when they wrote this report, this might be current, not reflecting.
Well,
The dates were the same.
if I understand correctly, environmental receives the report, either by fax or email. They enter it into, what's the name of the system?
NEBS.
NEBS?
It's a state
The state website. And then the nurses get the information from that website. So I'm sure it's just a
Okay.
crossover.
Which is
encounter.
interesting, yeah. I thought that 25 or even 31, that's a lot of dog bites.
They're cranky.
Spring and summer and fall, there's a lot of stray animals and a lot of bleeding hearts and people trying to pick up stray animals. Saving baby raccoons and, you know, it happens.
On the food safety division report, with the concern of products that were served without inspection, do we have any illnesses related to that or anything like that?
This was kind of an unusual issue with the Indiana Board of Animal Health and also the USDA. Because this product was being produced without the meat being sourced the way through the channels it needed to be. So they pulled us into it because it was in the county, and so it's actually multiple agencies working. There is none of this product in Grant County. Our people went and looked at all the places it had been distributed, and we were told by the USDA and by the Animal Board of Health that our job is done with this.
It was just being done at the BK Drive-In. Okay. Yeah. Interesting case to read. Must be
Car music from outside, yes. They're sharing with us.
I can't understand what they're saying.
Maybe it's better.
The beef is okay.
Hepatitis C seems to be, I mean, maybe because we're seeing the numbers, but I was a little surprised by that. Current, or it says current, past or present?
Yeah, I get a weekly update from the state on all the communicable illnesses.
Would West Nile be on this list if there were any cases?
If there were human cases.
If there were human cases,
They do
okay.
have their own dashboard,
Okay.
which is only updated twice a week.
I appreciated getting that notification.
Yeah. And where my Hep C went on this. According to our nursing division, most of these reports are coming in through local clinics that do the screening of all
Mhm.
clients that are entering their care.
Mhm.
I don't have that. Interesting. Our animal bites for the year are 67. This month, in 2020, this month, we have 13. This week, we've had 2. And then we're behind where we were this time last year by 12 bites.
Okay.
I think one positive thing is we've not seen any measles in our community, so that's an encouraging thing. So
And that's been declared over for now by the state. For now.
Do we need to approve these?
any additional comments or questions on the division reports? If not, yes, Dr. Turkey, I'll entertain a motion to approve.
I make a motion that we approve.
Okay,
I'll second.
thank you. All in favor of approval of the division reports as presented?
Aye.
Any oppositions? Hearing none, they will be approved.
Kara, I motion, she second.
That takes us to health officer notes.
I actually don't have a lot today. The summer season seems to be quieter with a lot of the things that were very pressing, like our budget. We had that approved our last meeting, and Tara and I have an appointment with the council on the 27th, it's the Wednesday, 27th of August instead of the 28th, to present our budget. Our understanding is that they're looking at items, they're looking at the entire budget, but really making a decision on the non-personnel line items. So we won't get a final approval on the entirety of the budget until
End of October.
end of October, but it's subject to change up to December 31st. So we're just being watchful and waiting on that. We are presenting a budget that's 56% of this year's budget. And that's been possible by not filling multiple positions that we had that had been approved already. So we're trying to be hopeful, but the county, just from watching council meetings and all, they don't know what's happening because of property taxes and all, so it's just very unknown what they're gonna be able to approve to any division within the county or any department. I think it was in Tara's report, but we are starting this prenatal food, which is super exciting. They will be starting on the first Wednesday in August, the first Thursday in August, and they'll be coming to Grant County from 10 a.m. to 2 p.m., or 10 to 12 p.m., 10 a.m., 12 p.m. every other Thursday, first and third Thursdays. The state health department will be here offering multiple services to pregnant women, and also postpartum lead testing for children that are of age, and STI testing for the mothers if they want it. But once they're enrolled, they're good for a full year. So even if a woman is 36 weeks pregnant and she enrolls, she will receive the food. She can receive the food twice a month for a full year from registration. And they're supplying a box of pantry goods, things that don't spoil, and also a box of fresh produce with some education on how to best use that for the health of the mom and the baby. So we're excited about that. And basically we give them a place to park and some storage of equipment and
Where will they be? Here's the problem.
Yeah,
So the team is coming a week next Monday afternoon to decide if it's gonna be where we did the testing or out here in the back 3 parking places. They'll just look at what works best for the bus that they're bringing and figure it out, but it'll be out this door. So,
Will you know ahead of time what food will be in the box, or will you not know? I'm just thinking, like, we have a mobile kitchen that we've used for some options to show people how to cook with some of the food, that I'm sure we'd be happy to help partner with you all if that was something you're interested in. It's just sometimes when we've tried to do that, like with Second Harvest Food Bank, we don't know what food we're
right,
gonna
and this
have.
is Gleaners that's providing the boxes, so I don't think we're gonna know ahead of time what will be in them.
But that does sound like, I mean, even having somebody here, because if it's a pineapple, how would you even cut up a pineapple? I mean, things like that, and who knows what's going to be in the box. But if you had an expert that would be able to say, this is what you would do with this food, whether you've ever seen it before, might be good. Like spaghetti squash, like what's spaghetti squash?
Right, right.
So I'm just thinking that it might still be useful to have somebody here without the kitchen, but at least to give words of
You know what,
wisdom.
Amy Ingram is on this team that's coming Monday, so I will mention it to her.
Yeah, absolutely, if there's something we can do to help.
Yeah, sure.
and then one other thing I wanted to highlight from our school health liaison, and it was in her report, but I just think it's really good to highlight, is she is certified to train school staff for CPR and to get them certified. So we have that now available to all of our county schools if they want their staff to have formal CPR and AED training, that is available and something that we can provide as a health department. And one of our MOUs that we approved was our food pantry in the local schools. And that was an initiative between the health department, our school nurse liaison, and Purdue Outreach. And they have, I don't have that email, but I think there's 4 high schools in the county that are working and getting this food pantry set up. And part of it is not just setting it up, but teaching them resources to sustain it. Because we're just the startup with the supplies and the food and helping them see how it's sustainable. And so we're excited that those will be launched as school starts in a couple of weeks. I think that's all I have, unless there are other questions specifically for me.
Thank you. I don't see that we have any old business to go over. We have some new business. Josh, if you'd like to share with us a little bit about what you've got going on there.
So some of you may know that I became a lead inspector and lead risk assessor for Grant County. There's a dashboard. If you'd like, there's a dashboard on the, you've already seen it, you want it? Okay. There's a dashboard on the state website that's showing list risk assessors and inspectors. It is not up to date. But if you look at it someday, you'll be able to see that there's very few of us in the state. So when we got this, I'd asked if we could get an XRF. And I did some research and found out that the SIAPS one would be the best. And so this is a brief overview of that. It talks about how good of an instrument it is, but how much it would save us in the long run. Yes, the SIAPS XRF costs more, but there's no disposal of the radioactive isotope. There's no kind of handling license that you have to have. There's no serious risk to public health in my handling of it. So, and it also talks about in there a little bit us doing our own clearance and not having to pay Green Tree could save us about $1,300 per case. Now, we don't always do the clearance, but we would more than likely always do the initial inspection and risk assessment. And with that being done, said, I haven't done any yet. But my first one will be this Friday. The state will come here and help me conduct it. I've gone through training over the SIAPS machine, and they're gonna kind of help me do the rest of that. So now I followed along with Green Tree and their inspector and did a kind of a clearance. He's so fast, he's got places to be, so it's kind of hard and difficult to kind of stay along with him, but I, for the most part, got it. But using this XRF gives you an instant reading. You don't have to wait, you don't have to send stuff to the lab. I play around with it sometimes, just check different things in the building, see if there has lead in them. There's a coffee cup in my office that has a little bit of lead in the paint, so I don't use it, it just holds pens, so I'm probably gonna get rid of that. But anyway, I brought it in. If anybody would like to look at it, can I set this right here? Sorry, there's not much room. So, pretty fancy case that it comes in. And it's this here, it's this machine. And it comes with a wrist lanyard, and it's so expensive I will never hold it without the wrist lanyard. So, but it's pretty simple to work. I mean, all it takes is this metal clip, you put it on here, and you calibrate it, and then you get a block of wood, and then you have to calibrate it 3 times. So there's a blank that says 0, or it would show 0, and the other one shows 1 or 1 to 3 on the lead on that. So you have to calibrate it each time just to start the test, and then you can go do everything that you want. And you don't have to categorize anything. You just go through and you just take a picture of it, and it automatically does everything for you. And then you come back here and you plug it in, and it automatically prints out a report for you.
That's awesome.
So you don't have to go through and say, I did this at this time, this level, things like that. You just got to get at a start point, and then everything else gets figured out for you. So if anybody wants to check this out, it's pretty neat. But I just wanted to kind of show you what we got and how it would benefit the community. I talked to the people at SIAPS for several emails about why is this better than anything. I kind of went over that at the beginning, but mostly it's so that the readings are instantaneous. I can show people. I could go to take this to a school and maybe work with their health, their nurses or things, and show them these things could have lead in them. Educate the public more and more, and I think that was a big selling point for me, just to have it there, so instant reading of what could have lead and what couldn't. So I think a lot of people are like, oh, lead's a thing of the past. Since they took lead out of gas, I guess everybody's okay, but that's not really how it is. So, Are there any questions?
So how many times do you think you'll use it in the next year?
I don't know. I think we figured that up. I think once a month is
We
the
had
average.
11
Right.
lead cases that required assessment in 2024. So you never know. I mean, numbers could be up, numbers could be down. But for every case, it's a minimum $650 for an initial assessment. And then if any lead is found, it's another $650 for the clearance. We have a case now that they have tested 4 homes now, the daycare, the yard. They still can't find where this child's high numbers are coming from. So it's hard to tell.
Eating non-food items.
Well, it's
Sneaking around
possible.
eating things that are not supposed to be eaten.
Yeah.
Most
Most
likely
of the
She's
dirt.
been, this is a tough case. They've even had
Are the levels
specialists.
astronomical or, yeah.
She's been through chelation several times.
wow.
Yeah, it's,
Yeah, the one case that I had that was a super high level, the little girl was sneaking behind the couch and was eating plaster or something from behind the couch. And I mean, unless you're gonna move every piece of furniture, these kids can sneak around and you don't have any idea what they're getting into.
yeah, it's been a tough one. I mean, the state's even had experts come from like Iowa and Michigan, I think,
Wow.
and go over, just can't figure it out, so.
Yeah, and if they don't pass clearance, it's got to be done again. So, help us kind of pinpoint
Well,
this machine.
another thing that makes this machine so much more ideal than the previous versions, the other one was more expensive, but then every 2 years you had to spend $5,000. You'll remember that.
Yes.
To get it.
Which is why we didn't do it back
Right,
then, because we
right.
didn't have $5,000 every 2
This
years
has
to recalibrate or whatever.
Yeah,
to do
an
that.
approximate 20-year lifespan and requires none of that. None of that, so.
So would you
And-
ever consider sending it out of the county if they had tough cases? I mean, and
It-
charge them?
I mean, they could pay me pretty good.
It was
I'm just kidding.
$27,000.
No, but I mean, you go and
25,000.
do it and you charge them.
We talked about that, we didn't know, or,
I mean, I don't know the legality of it, but I mean, there's probably not many of them in the state.
right?
There was talk about that being a possibility, and maybe down the road. What did you say, 4 to 5 hours for an assessment?
Mhm.
That's a long time out of office, and how much do you charge? At this point, no, it's not a consideration. That doesn't mean it can't be in the future. But it has been talked about multiple times.
And this is just one part of his job. So-
Right, right. Yeah. So,
Especially in the summer.
it's pretty exciting though.
Yeah, because you also do mosquito
I do vector
correction.
control.
Yeah, vector, yeah.
Yes, I did a bunch of larvicide this year for the first time, which I researched it. It got an organic material that wouldn't be harmful to the public, but would also keep mosquitoes from replicating by breaking that surface tension of the water, things like that. And I did all the communities that were going to be at, so I didn't do every town of every catch basin, but I did every like area, like a baseball field, a park, things where I knew people would be together during the summer. So I think that's helped a lot. I haven't heard anything. I've asked people if they've had more mosquitoes this year than not. I mean, we've had a lot more rain, so I assumed it was going to be more, but it didn't seem to be more.
I went past a pond the other day on the corner of a pretty busy intersection, and when I looked over, I was like, oh, goodness. And you could just see them breathing. I mean, they were like mosquito heaven, and I was like, and then I kind of forgot about it until you just said that, and I'm like, that's my guy right there. We'll be talking about that later.
So,
Shooting that address.
Yeah. It's also close to an event center, and it's, I mean, on the other end,
Yep.
but.
I still have some left, and they have a shelf life of 2 years
Oh,
or
I
something
know.
like that, so I want to use as much as I can. I still probably have about 150 of them. They're little biscuits, and they're easily chuckable, is what I call it, so I can throw them from the vehicle. A lot of times I miss, and I have to get out and do it, but I still do it, so, all right. Is there any other questions about the XRF?
That's cool.
Okay.
Thanks, Josh, for bringing that and
You're
showing
welcome.
Josh.
You're welcome. You guys can ever want to come check it out and hang out with me for 4 or 5 hours.
Is there any other new business for today's meeting? All right, anyone for public comments?
There's only one public person.
Hearing none, I'll take a motion to adjourn the meeting.
I'll make a motion to adjourn.
Second. Meeting adjourned. We will meet again on September 22nd.
Because I met Sandy.
What country are you in?
Sandy.
Yeah.